Welcome back. Thank you for staying with the front row. We continue with our discussion, and I just want to sample one Blessed Gift's tweet, and he says, this is a good discussion. The government and other judicial institutions are doing the best to address the issues to do with the GBV, but unfortunately, some of these perpetrators still find a way to bend the law, and not forgetting the fact that customary law is equally a problem. This is your area. I'll let you handle that.
Yeah, I think I would say that the court process has its weaknesses, and you note that especially in cases relating to gender-based violence, sometimes evidence is not very easy and watertight to come by, and so you find that some of the evidence that's presented to court may not be at the standard that is required for conviction. So you find that in those instances, someone may be released on that basis. And I think what Alberta was saying, does the community know, especially those who are victims, how do they ensure that they safeguard evidence that would then assist in the court process? But when it comes to customary law, I think we have a tendency within our system sometimes is to, our law sometimes goes ahead of culture. And in the sense that we are asking communities to adapt to something new, yet they are still in a different frame of mind on some of those issues.
Yeah.
And I think what needs to be done to address some of those concerns is that when laws are being crafted, there's a need to engage the public more. And our constitution now is very clear that public participation is really important, especially in developing law and policy, so that the community also understands why are we having this shift. Why is there a need to stop some kind of behavior? Why is FGM, for instance, bad? And so I think when communities are involved from the time of developing of the law, discussion on the law, until now enactment of the law, then the law becomes easily implemented, even by the community itself. So we are seeing a situation where the lawmakers just have their conversation, create law, and then force communities to comply.
Yeah.
And that has not been working very well. So I think there's already a framework to engage with the public in the lawmaking process, which we can do, and that way we can also change culture, because culture is not fixed. Culture is dynamic. It can change, and it has changed. And so with that approach, I think we can also kind of replace some of those harmful practices with practices that are beneficial. And we've seen in some communities, for instance, where FGM has been practiced, that they are now replacing the practice of FGM with, a ceremony for young girls.
Yeah.
So that then kind of symbolizes, the transition from, childhood into adulthood, but without the actual cut. So I think replacing some of these practices with, other new innovations that can fill in the gap so that the community can change its way of doing things is a good way to really have customary law kind of adopt to what we now call formal or state law.
Okay, and Alberta, I want you to add your voice on this, because changing what my grandmother or someone's grandmother is thinking in the rural is not as easy. And let's not forget, there are police men and women there, but when you go to Rome, you do what the Romans do. So you tend to get sucked into the cultural beliefs. Is this where we play an important role as people? When you go there, you educate people. And how do we do it in a way that is so sensitive that we don't look like, we're not considering the cultural beliefs?
So when we have the conversations, it's not that all, we start from then, of course, not all cultural practices or beliefs are wrong. Some of the ones that are good, are positive, we continue with that. Then you rightfully said, and not just the police, even in our media spaces, even in the meetings, at workspaces, even at the hospitals, rightfully, as you said, there's a lot of unconscious bias. So I could come here and we're having this discussion, but when I reach home, I beat my husband, for example, or I do not have provide equal opportunities for between my sons and my daughter, or things like that. So it's addressing their conscious bias, but also understanding that it is not an overnight things. These are social norms that we've grown up with.
Yeah.
So it's, for example, when we have the textbooks, when I was growing up, there was it Kamau, the driver, and I can't remember who it starts from there,
yeah.
you know, or when we buy the toys and it's a doll for me and an aeroplane for the boy, you're already telling him he can be an engineer, he can be a pilot, but for me, it's the cooking set,
yes.
you know. So it starts from that, you know, the education, the textbooks, the media. When we start saying, for example, Mpangwa kando, you know, is the in thing and things like that. So you're already inculcating a certain behavior, you know, and I'll give you a rough example. When our neighboring president became a president, it was grandmother of four has become president. We never hear grandfather of four has become a president.
Yeah. So
it's that daily conversations that we feed into ourselves, and then also tolerating violence and becoming bystanders. So it's, I could be this, I don't want to use the police because I think we bash them too hard. They do a good job. I could be this clinician, yeah, I work at the hospital. I could be this social worker, and I know everything else, and I've gone to school and I've done all this, but there's that unconscious bias that we need to address, you know. Understanding, for example, that, and I've seen it in different spaces. When we talked about, earlier you talked about people living with disabilities, and you see them being treated worse. Yes, they're more vulnerable to gender-based violence when you look at the cases and everything else. And so it's treating everyone, you know, and being deliberate on the inclusion and diversity, and understanding that it's not an overnight thing, but it's that conversation on a daily basis. So it starts from when you go to the workspace, Ashley, and you're having this press conversation and tea is brought, and you're there, and all the men look at you and they're waiting here. He's called Dom. He's waiting for you to go and serve the tea. So it starts by breaking that day to day, and in that break time, you say, you know, it's okay for you to also serve me tea. Yeah, I know we're not equals. You're a man, you're a female, and there are things that are different, but there is equal opportunity, you know, so it starts from that.
Sadly, people even go to an extent of quoting the Bible. That's how bad it is.
Yes.
So it's not just cultural practices.
Totally agree. You see, earlier, there's a guy who talked about Masla, you know, in the documentary, and said, let's stop this. Even the kangaroo courts, even before COVID, you know, a child would get defiled, wazee watakaa, they'll sit and discuss, pass a got, you know, and all that. But later on, this girl gets pregnant. That's when then you're brought for the client, you know, as a patient, and oh, let's follow up legally and things like that. So it's to understand that this is a human being and their human rights, and it's equal, and that apart from just church. So you'd go, as you say, even the Bible will quote, you know, and say that a woman does not stand, I think, on the roof and shout about the problems of a house. A woman is submissive. So you're there dying, you know, every day being beaten. You're facing all this violence, and you're not living because mwanamke ndo shikilia nyumba. And a lot, again, also from societal, you talked about stigma, you know, what kind of woman is this who lives a society, and you're treated differently, or you're from a single mom and people treat you differently, you know, seriously, because of that, for example, in your dowry negotiation. And that's what then is every day there. So we also need to stop double talk. If this is the conversation we are having, it's hard. But when we also go to our own individual spaces, if I'm in a family meeting and someone has a black eye, and I know it's not from falling down the stairs, I should be bold enough to call it out, you know, and provide that support. So that's where we need to reach. If someone is all coming to work, or they're there and it's presentism, and you can tell that someone's performance, Alberta's performance has gone down. So, you know, being keen enough to say exactly what it is. We talked about mental issues earlier. It's really tough, both for service providers, but also the public. So it's being keen and deliberate, you know, to really address those issues and just call it out and ask for help or understanding where we do not. There's so much help around.
And I like the fact that you brought around about the mental issue aspect. Maybe, Dr. Mbogo, you can tell us, when, for example, let me use my example. If I get violated by my husband, my spouse, or whoever it is, does it have a trickle-down effect, not just to my children, but even to the surrounding, my neighbors and my family? And so how do they deal with it too?
Yeah, I think definitely does have an effect on, you know, the immediate family and the rest of the family, because the physical violence in itself is accompanied by the mental or psychological violence. So I think we have in a lot of interventions when we do have, whether it's medical services, there's always a need to also have some form of psychosocial support being provided to victims of gender-based violence, as well as if it was a child, then the parents of the child and anyone else who may need that kind of support. So I think the need to access, you know, all services holistically, so not just one form of it, is really important in terms of, you know, kind of rehabilitating people out of it.
Okay.
Yeah.
And the one thing that we've been talking about is the fact that there's going to be stigma. So then how do you accept them back to the community? Not just those that are victims, but even the perpetrators, because either way, they're going to come back to the community. So how do you differentiate it? Or, you know, how do you handle it?
So the reintegration back to society starts even way before the abuse happens, so that then society understands that one, abuse can happen to anyone, you know, and we need to accept them back, and there's a whole response system, whether it's medical treatment or trying to reform the alleged perpetrator and things like that, and that the system is there to do that. Now, through the support of social workers and different institutions that work together within the referral system, they're able to do the assessments, they're able to know when reintegration is okay and how then it's done. They're able, for example, to tell you whether it's not yet ready. So we have shelters, for example, when survivors are not ready to be back, and then as if the survivor is to be reintegrated back to the family, you also have the family being prepared. So it doesn't just happen overnight, depending on the social assessments. You have the shelter, or rather the community being prepared, or the family, but you also have the survivor being prepared for the same.
Yeah.
Sometimes it is not proper or timely to do it. So if a survivor might need follow-up not medical treatment, like education. I've seen children who'd be taken to a different school, for example.
Yeah.
So it's really dependent on the social assessments, but bottom line, it's educating the public to understand that violence can happen to anyone, and we need to be more supportive. So we need to demystify mental wellness. I'll not be specific, but about 2 or so weeks ago, it was sad, you know, for someone to say so-and-so because of mental wellness. So it starts from that demystifying, you know, mental wellness or gender-based violence, and letting people know that this can happen, and it's up to us to be able to provide that support. So it's whatever spaces. I've been to schools where you'd go and the teacher would be like, "Nitie yule kijana alisodomaiziwa," you know, so
Yeah.
it's that. It's the conversation talking about awareness earlier, and the community education and everything else. It's that space, and then providing that support. So from the counseling, we have counseling also for the support system around you. So then forever, as much as then you'd be down and integrating back to society or to the community, you have this support system around you, and can be defined by the different spaces and your actual unique needs as a survivor.
Yeah.
Yes.
And you brought about the child, but then also let's not forget that these children who are giving birth at a very young age most opt to drop out of school, because here you have a baby you're taking care of. For the parents or the guardians of the family members of this child who has gone through early child pregnancy or teenage pregnancy, so then how do they deal with this? Because you see, most of this sadly come from a poor background. The mother is struggling, the father is struggling, or the family is struggling in general. So the child would either give away, and because of this, we've had cases of people getting abortions because of this. So how would you advise that family to handle this situation?
I think if the family itself is unable to support the child, there are other ways in which this can be done. So there are options like adoption that are available. The Children's Department also has a system called fostering, where the child can be taken by another family, whether it's a relative or otherwise, who can then take care of the needs of that child.
Yeah.
And if the father of the child, and here child I mean the baby, is someone who is working, then also you have there's a court process that you can take, and there are a number of non-governmental organizations that provide legal aid for, parents who need to seek child maintenance from the biological father of this particular baby. So that's another process that they can also pursue, so that they can then ensure that the teenager who has now had a child is able to go back to school.
Okay.
Yeah.
And there has been talks of teenagers or children being given contraceptives. Is this the right way to go, really? I like how you're smiling first.
So it goes back to the discussion we had earlier about sexual education,
Yeah.
and access to sexual reproductive health commodities. Commodities would include sanitary pads, the contraception you're talking about, and all that. And maybe it's important to mention at this point that there's actually a very big intersectionality between gender-based violence and sexual reproductive health and rights. So as we talk about, let me just speak to that a bit. When we talk about the teenage pregnancies, that's also gender-based violence. They're pregnant because they were defiled. This child is having a child. One of the biggest hurdles we faced at the center last year was that we had the highest number of teenage pregnancies in 20 years. We had 208 girls getting pregnant as young as 11 years. So they would come to the center, whereas we're very focused on prophylactic treatment. But this girl is coming, she's 5 months pregnant. You do not have resources, and this is now also as a country. We did not plan, for example, for antenatal care. We did not plan for the maternity, just to show you that it's not just the education, the taking care of these children. I met young girls who said, I don't want to give away my child. I just want my child to be somewhere, go to school and come back.
Yeah.
And I'm thinking, at my age, it's really tough bringing up kids. So this child bringing up a child, you meet them, I was with some of them today, and they can't even hold a baby. They can't even, the mental torture to it, the stigma you're talking about. So back to whether then contraceptive should be given, it's a balance. You also want to give contraceptive to an adolescent girl, and of course they have rights, they can assent, and there are youth centers, and there's all these conversations that are still there, I think even including in court. So it's really a balance between, everything else, this moral religious Kenya that we have, and provision of contraceptive to children, and specifically adolescent girls, vis-a-vis what is really happening. When you look at the HIV/AIDS infections, it's really gone lower, the age of infection. It's really now younger kids, getting HIV. That means they're sexually active. So it's a conversation about all that. But whether the sexual education should happen, yes. Whether the contraceptive should happen, then waiting for government to let us know.
Okay.
Yeah, but of course there's contribution from all CSOs and all state agency discussion on the sea.
Okay, we're running out of time, so I'll give you each 1 minute to give you your parting shot on this matter, because it's a conversation that goes on. It doesn't end here. Maybe I'll start with you, Dr. Mbogo.
I think the importance of us taking personal responsibility. So in terms of reporting, or if you have a friend or a neighbor who has faced any form of gender-based violence, what are you doing about it? I think that is a challenge that I would give, that we also need to be more sensitive to those around us, and not say it's the state or it's non-state actors, that's their work, but then take our own personal responsibility to bring about the change that we want to see.
Okay, Alberta, your parting shot.
The space of gender-based violence is tough. I mean, it's really draining. But my parting shot would be the last 1-2 years, really excited. Seeing the different, even just us having this conversation, that's a big milestone, so making everyone celebrate their milestones. Yes, we're not all at the same space, but being able, as Dr. said, having this conversation in whatever spaces we have. If it's KTN, for example, get the gender policies, sexual harassment policies in place, have actions, have mental wellness sessions, so it's our own spaces. If I go home, what conversation, how am I modeling, for example, for my children? I'm not perfect, but it's all of us, if I'm in education sector, how then can I make sure that all the girls, we saw the girl who almost committed suicide on your channel yesterday, how then do we make sure that we have policies that all children are able to access education and affordable and quality education? How do we make sure, for example, the teenage girls are able to go back to school and also have provision for the children of the children, you know, and things like that. So the laws, how do we make it really happen? We talked about the implementation, the response system. So it's just, what I say, everyone just to do their job and to do it well.
All right, so that's a really good place to end it. Thank you very much, Alberta Wambua, who's the Executive Director, Gender Violence Recovery Center, and Dr. Annette Mbogo, Executive Director, Kituo cha Sheria. Of course, unfortunately, we could not have Kate Maina Voli, who is the County Director of Plan International, because of connection problems. But thank you very much for being part of this conversation. I'm Ashley Mazuri. Enjoy the rest of your viewing.